So is there a specific low SHBG TRT protocol?
Yeah, so when SHBG is crushed, the first thing we need to address is we have to figure out why. Just like with the high SHBG, before you go and try to affect change to any biochemical markers in your body, you want to first assess why, because you really have one opportunity before you intervene to figure out what's going on. So oftentimes we'll find this to be an anabolic steroid use related component where guys are running periods or cycles of androgens, and this will have a pretty large crushing effect on SHBG levels, specifically if they're using oral synthetics. But it's true for injectables as well, including bioidenticals like testosterone. The higher the dose, and it is dose dependent, the higher the dose in a single administration, the bigger the crushing effect on sex hormone binding globulin. One of the reasons you'll often hear that guys with low SHBG tend to do better on more frequent dosing is a twofold response. First and foremost, when you have low SHBG, your binding protein that allows you to carry testosterone for extended periods of time in order to be released on an as-needed basis is diminished, and therefore you are going through the hormone more rapidly, and when you excrete more rapidly, you're going on a bigger roller coaster ride of peaks and troughs. Therefore, by having a more frequent administration, you're helping yourself to stabilize the amount of free hormone in serum. Secondly, the crushing effect in and of itself of larger anabolic doses on SHBG are therefore going to be diminished, because when you take your weekly protocol dose and instead of administering it as 1 or even as 2, by doing it 3 or more times per week, you're now taking smaller doses per administration, therefore having less of a significant effect on the lowering of SHBG. It does not directly elevate SHBG, but it does allow other markers which may normally want to elevate SHBG to work more effectively by inhibiting the further crushing effect of the androgenic compound. So this is one big misconception I often see in the groups is guys say, well, daily injections raise SHBG. That is an incorrect statement. Daily injections help to inhibit SHBG less than larger dose, less frequent injections. So there's a big difference between alleviating inhibition and actually agonizing a response. So very often confused, and hopefully this will clear it up for some of the guys who feel that way.
Sure it will, thanks.
Hey, thank you for watching. And if you want to learn a ton more about hormone optimization, do this next. Click on one of these thumbnails and I'll see you there.